Okay, so I'm going to be giving a report to the new day shift for Miss Mary Carter in the ED. She's a 62-year-old female who came into the ED with shortness of breath, pleuritic chest pain, and dizziness. She's anxious, diaphoretic, and in acute distress. Her vitals are 82/50 for blood pressure, heart rate's 118, respiratory rate's 28, and SpO2 is 95. She weighs 80 kilograms, has one large IV in her right AC, and she had a left hip replacement 2 weeks ago and has mostly been immobile since the surgery. She has no history of lung or heart disease and no known drug allergies. Okay. Knock, knock. Hi, Miss Mary. How are you doing?
I can't breathe.
You can't breathe? Okay, let me go get some oxygen for you real quick.
Okay.
Okay, so I'm now placing a non-rebreather on her since she's having a very hard time breathing. Just take some deep breaths, Miss Mary.
Catch my breath.
Okay. Hopefully this will help you. Okay, I'm gonna turn this up to 15 liters. So I'm gonna do a quick assessment on you, Miss Mary, okay?
Alright.
Okay, her oxygen did go down, but now it's starting to go back up. So she is gonna be tachypnic and hypoxic, and then she also has some chest pain going on right now. So we're gonna look at her map. We're gonna see that it is 60, so we definitely need to do something about that because we never want the map to be less than 60. She's gonna be pale, tachypnic, restless, and her breath sounds are gonna be clear, but they're gonna be shallow. And then she's gonna have delayed cap refill. So I'm going to go call the doctor. Ring, ring. This is Gracie calling for Dr. Smith on Miss Mary Carter in the blue room. She is presenting with acute shortness of breath and chest pain. Her vitals are BP 82/50, heart rate 118, respiratory rate's 28, SpO2 is 90% on a non-rebreather of 15 liters. I just need some direction on what to do with her. Hi Gracie, this is Dr. Smith. I just wanted to inform you that I put orders in for another IV. I have some labs ordered, and then I want you to administer 250 ml bolus of normal saline over 10 minutes. And then just continue cardiac and oxygen monitoring. Okay, so I got orders from the doctor. I'm going to insert another IV. I'm going to do ordered labs. I'm going to do a CBC, a CMP, a PT-INR, a PTT, a D-dimer troponin, and ABG. And then I'm going to do a 250 milliliter bolus of normal saline over 10 minutes to help improve her MAP. And then I'm just going to continue to monitor and her heart rate and her oxygen. Obviously clean with alcohol swab. I have gloves on, all that. Hook up that. That's a normal saline. Okay, so I hooked up the fluids. Her MAP is still not increasing. So I'm gonna call the doctor back. Hey doc, so I did give her fluids and it's been about 10 minutes. I think that we need to order a vasopressor for her.
Okay, I'm going to order for you to start norepinephrine. We're going to do 0.05 micrograms per kilogram per minute. And then I'm also going to put in orders for an echo.
Okay, here's the correct math that I'm going to do for the norepinephrine. Okay, so I'm gonna start the norepinephrine and the other IV that I inserted. And then echo came. They did do the bedside echo on her, and it showed a right ventricular dilation and a D-shaped left ventricle. And then this is consistent with a pulmonary embolism that's causing obstructive shock. So now we need to start thrombolytic therapy. So I'm gonna give Alteplase. And then I'm just gonna verify this with another nurse. So I'm gonna give 0.9 milligrams per kilogram over 60 minutes, 10% total as an initial bolus over 1 minute. Math. Verify with another nurse.
Looks good to me.
Okay. So hang my Alteplase, and it looks like her oxygen is improving and her MAP is stabilizing. So we are getting, MAP stabilizing, oxygen is improving. We just want to make sure that we assess her vital signs, monitor for bleeding, because Alteplase can cause bleeding. Check her gums for bleeding, IV sites, all that, they all look good. So, and then if you guys make it to the end, S-bar for ICU.